Where's the chat? Here it is. All right, good morning, everybody. How's everyone doing? Can you see me and hear me? I see some good mornings popping up in the chat. Awesome, awesome, good deal. All right, guys, thank you. Phone's going crazy. Thank you guys for joining me this morning. We've got another day, we've got another big chunk of stuff to work on. Today we are going to work on chapter 7 in earnest. Letting people in here too. So we've got another little chunk of chapter 6 that I wanted to do as kind of a follow-up to what we did last time, talking about bone damage and diseases. And so I posted that on the chapter 6 folder. There are guided notes for it if you want to go ahead and get guided notes, but we'll do that in just a little bit. But I want to start by picking up with that group activity that we left off with last time when I ran out of time. To start getting you thinking about the skeleton. There are a lot of parts of the skeleton to learn, so I want to kind of break it into chunks. So the goal for chapter 7, which is entirely lab, you know, there are a couple little concepts, but pretty much it's entirely lab, learning the bones and learning the parts of the bones. And that's the point of it, is to learn the major parts of the skeleton, the names of all the bones, and for some of them what they do, and then to learn the bone markings. And the bone markings are the little landmarks on the bones. And we don't just learn the landmarks to learn a bunch of crazy words, although it will feel that way at first. We learn the landmarks so that when we apply the skeleton, when we start to look at the muscles and the ligaments and the nerves, blood vessels, a lot of those will refer to the bones, or they will have similar names too. So this is the first step in beginning to really build a good concept of the body in your mind in terms of what are the parts and how do they fit together. Okay, so it's going to seem like a lot at first, and it is. It's a lot of crazy words, a lot of Latinized things. But we're going to start with the bone markings, do a little bit of review with that. And then we'll come back to it later, and we're going to work on the axial skeleton today, which is the skull. That's where most of the parts are. The vertebrae and the rib cage today. Next time we will pick up with the appendicular skeleton. Now, test 1 is going to open Wednesday of next week, and it will be open all the way through the following Monday. You can thank my Tuesday, Thursday class. They taught me into one more day. So it'll be next Wednesday through the following Monday night. So that doesn't give you a whole lot of time to study the appendicular skeleton, the arms and legs, if you put it off. So between now and next Monday, I'm going to suggest you guys work ahead, and then we can work on it some more. And then our class time can be a good review for you on that, okay? What are my suggestions on learning the skeleton? Normally, you know, in a regular face-to-face semester, we would talk about it just a little bit in class, and then we would break out the actual skeletons in lab and put our hands on the bones, manipulate them, look for the parts. So it's not just looking at diagrams. Unfortunately, we don't have access to that. I really wish we did, because it's really great for tactile learning, and it really helps you get a good concept of what the bones are like. But we don't have that. So instead, what we're going to do is work with diagrams a whole lot. Now, that being said, I think probably the worst way to actually get a concept of the skeleton is just to memorize diagrams. And you definitely don't want to just memorize one diagram, right? I know you got to start somewhere, but just looking at and reading the words and trying to figure out which word goes with which line on one diagram, that doesn't really help you understand the skeleton. It also doesn't help you in life because, I mean, no one's going to ask you that, right? No one in a nursing profession is going to hold up that diagram and be like, what's this line? What's line number 3, right? So it's kind of a waste of time if you take that approach. So what I would do is, you want to start looking at diagrams. They're a good jumping off point. Everybody's admitted. But you want to kind of move from the diagram fairly quickly. So that's why I've given you a couple of different tools to use for learning the skeletal parts. You've got the PAL, those set of diagrams that you can manipulate that will quiz you on it as well. You have videos to watch that will help you. And then if you're a tactile learner, hands-on, make yourself a model. Get yourself some Play-Doh and start making the skull. Because then you can say, oh, look at the skull. There's this little part that's supposed to be over here. I'm going to put a little chunk over here, a little triangle over here, and I'm going to call that the mastoid process, right? So it doesn't have to be a great skull, but get your hands on something like that. Another really great kind of funny resource this time of year are Halloween skeletons. This is the one time of year where skeletons and brains are readily available in the stores. Kind of amazing. Now I will say they're not anatomically accurate, right? Some of them not at all. In fact, I started to pick one up the other day and I was like, this one's so far off, I just don't even want to show it. But if you get yourself a basic skeleton, you can modify it, right? It's a cheap Halloween skeleton, who cares? Get yourself a little model and then get yourself some Sculpey and put little features on it, draw on it, cut it up, do whatever you need to do with it. That would be your really cheap model. The real models, the very anatomically correct ones, are hundreds of dollars because they, if you have a skull that you can see all the features and then you can actually open it or even take parts apart and they fit together correctly, those are very expensive. But you can get yourself a cheap one and work with that. And also a brain, grab a brain too, if you can find a good cheap brain, because we're going to be working on brains too. Okay. And if not a requirement. Okay, but those are just some things I suggest. It's a lot of memorization, so you want to take it in small pieces. Don't say, I'm going to learn the whole skeleton today. You'll make yourself crazy. Say, all right, I'm just going to work on the face bones today. And there's plenty right there. I'm going to work on the face bones, and I'm going to review those. Go over them, take a break, come back, quiz yourself, see what you're still missing. And then the next time, I'm going to do the cranium. I think I'm going to do the vertebrae today. So break it down in small chunks with as much repetition as you can. And that's going to help you guys out with learning these things. We'll work together today to see if we can come up with some memory tricks and things. And I will refer you to videos, and I'll tell you, of course, all the memory tricks I have as well. Okay, but that's a long speech. That's where we're headed, right? It's learning the skeleton. So it is a big chunk of information to put in your brain. Everyone always feels that way. I feel that way when I start to look over it again, like, oh, there's a lot of parts. But it will go in. Trust me, there's room. And besides, we're going to go on to the next chapter and learn the joints. Then we're going to get into the muscles, and there's even more words for muscles. So this is just our jumping off point. Okay, let me take a look at the chat. I see stuff happening in chat. Yes. So the bones listed on the lab handout, those are the bones and the markings that you are required to know. If it's not on the lab handout, then I'm not going to require you to know it for testing. Okay. So with that, I know that the resources that I've given you to help you study have extra parts. The videos go over some extra parts. the pal definitely goes over every part on the skeleton, right? So if you come across those, you don't have to learn them, okay? But I think what we're going to do today, and we'll give it a try, is I want to work with you guys to build a study guide just for you guys, that just have the required parts on it. So we're going to do that during the second half of class today for the axial skeleton. So that will help narrow it down. It'll give you another resource to work with, okay? But you guys, you have so many resources to use. Back in the Stone Ages, right, when dinosaurs roamed the earth and I was taking anatomy. Well, I actually learned it, I didn't take human anatomy first, I took comparative anatomy of vertebrates first. So I learned my skeleton, I learned like the frog and the amphibian skeleton, the reptile skeleton, the mammal skeleton, all at once, fish. So I come from that perspective. But anyway, back in the Stone Ages, we didn't have these resources. We had one set of diagrams in a book and the skeleton, and that was it. So these videos would have been just amazing. Videos and the practice things would have been great. So use your resources, guys. Only thing I had that you guys don't is the skeleton to put my hands on. Oops, here comes some more folks. All right, good. So any questions about that, about what our approach is going to be? I'm talking too much. I need to get to the actual material. All right. So we're going to dig into that. What I want to talk to you about first are these things called bone markings. And again, bone markings are like little landmarks on the bones. They all do something. They either make up a joint, like part of the elbow, where two bones will join together. They might be an attachment point for ligaments or tendons. Some of them stick out, call them protuberances or prominences. Those things stick out of the bone, and some dip in. Some are little holes or canals or depressions or little bowls, things like that. So all of those little features have names like condyle and tuberosity and fissure. And so the first part of our approach to the skeleton is going to be learning those things. And the reason we do that is because it's like trying to read a map without knowing what a river or a street or an exit is. If you don't know what the symbols for river, street, and exit are, and you're looking at a map, especially if it's in a foreign language, you're going to be pretty lost, right? There's a funny story about people who visit Germany. Apparently, I've never been to Germany, but apparently in Germany, they are really, really good about marking exits on the Autobahn. So they'll have a sign up that says exit, very prominently displayed. And it's this particular German word. Well, a lot of people, if they go there and they don't speak German, they'll think that it's just this city and like every road leads to that city for some reason, because they don't realize that it's an exit. So if you know what exit means, it's going to help you out a lot, right? To interpreting the layout of the land. So the same thing goes for the bone markings. If you know what a condyle is, that a condyle makes up a joint, then you're going to know that that part of the bone has to be where some other part of the bone meets. It's going to help you learn these terms and kind of conceptualize it. You're also going to use your directional terms a lot starting today. Superior, inferior, lateral, medial, dorsal, ventral, in combination with some of these other crazy terms, okay? Those are going to help tell you where these parts are. All right, given all that, let's learn about the bone markings. Here's what I have for you. We are going to start off with that Jamboard that we were working on last time. I'm going to put you in groups. I learned a little bit more about the group setup, so I've got a better control over that. Let's see, it is, where did I put it? Right here. There we go. Let me scooch this over if I can. All right, so this is the Jamboard. Can you guys see the Jamboard on my screen? Everybody see the Jamboard on my screen? Yes, okay, good. All right, excellent. So this is the Jamboard we're gonna work with. I'm gonna put you guys into some groups here in just a minute, and I want you guys to fill out this table. You can see that the bone markings, the general names of the bone markings like tuberosity are listed here on the left for this table. And then there's a space. I want you to give me a basic description. And you can look these up, you know. There are charts in chapter 7 of your book that have them. You can also just Google them, of course, if you're on your computer. But I want you to look them up and give me a definition. And it doesn't have to be formal. In fact, if it's in your own words, that's even better. You can describe it as a bump or a hole, okay? That kind of thing. And then I want you to give me a name of a specific example of one. So not just tuberosity, but maybe tibial tuberosity. So you might Google, look up example of tuberosity, okay? Find your example here. So you guys can split these up however you want to in your groups. Notice that these first ones, these are all prominences. These are all things that stick out of bones, but they have slightly different shapes. The second page, these guys, yeah, these guys all attach to ligaments and tendons. Yes, these are all guys that attach to ligaments and tendons. All of these on the third one attach to ligaments and tendon. Oh, no, I'm lying. All of these guys on the third page make up a joint, except for this last guy on the bottom, fossa. I just stuck him on here so that the numbers of things would equal out. But this fossa, that's going to be a depression. But these guys all make up a joint where two bones touch, basically. And then this last page, these are all the rest of the depressions. So little dips into the bone. So you can split this up however you'd like. You can use the little Post-its or the typing tool to fill this in. And then here's the real challenge. I want you guys to look on these diagrams, and I want you to find your example of your bone marking, and I want you to label it on here. And notice I put a bunch of slides. These are from your guided notes, directly from the guided notes, but I stuck them on the slide here. And so you just need one example of your feature, and you can find it on here and label it. If you want to circle the part, you can. But of course, you're going to have to look up a diagram and take a look at it. But that's just going to have you taking a look at what these kinds of features look like and kind of associating it with the word. And because there's a whole big group of us, we can knock this out pretty quickly. Okay. Does it make sense what we're going to do? Yes, y'all there? Y'all there? Let's see how many groups. I had 4 groups. Okay.
Yes.
Okay, awesome. Thank you. Okay, then what I'm going to do, stop sharing. I'm going to put you guys into 4 rooms. Oh, let me go ahead and give you the link for the jam. That's going to be easier. By the way, some of you pointed out last time that you've been having trouble with opening the jams and inserting images and things. So I went back and I fiddled with the settings. And so I shared it with you guys. So now you should be able to open it correctly. And if not, let me know. It may be that Google changed some of their settings when they changed to Google Meet, that September 30th was a big day for them. Anyway, let me know if you have problems with it. Okay, I want this to be a useful tool for you guys. Okay, I just put the link for the meet, or not the meet. Good Lord. I just put the link for the jam in the chat window. So open chat and see if you can get in there. Hey, is it opening for everybody? Got in, got in. Yes, awesome. Good. Oh, couple more people jumping in. Ooh. Here comes everybody. Welcome back, everybody. I hope that wasn't too abrupt, bringing you back to the main room. But it looked like you guys are making good progress. I will mention that on the diagrams, if you want to put a specific name of the feature, that would be better. So don't just put tuberosity, put, you know, if it's the tibial tuberosity, put that. So we're going to go through these together, and I'll ask you to, if you don't have something specific in there, I'll ask you to update that. Because you're going to be learning these parts, we may as well just address the names, the full names today. Okay, right now. All right, very good. You guys were doing great work there. Hated to interrupt you. It's always difficult to estimate the amount of time you guys are going to need for an activity, but we do our best, right? Okay, so I'm going to bring up the jam. Let's just see if this works. Let's try it this way. Okay. So can you guys see the jam on my Zoom screen?
Yes.
Yes, awesome. Okay. Let's try it this
way. Partially, like there's part of, it might just be my screen, but part of it's like cut out by like this black space.
Over on the right-hand side?
Yeah.
Okay. That's my chat window floating there for some reason.
Oh, okay.
And sometimes it'll show it and sometimes it won't. And I can't figure out what the difference is. But yeah, that's my chat window. But let me scooch it over. Zoom. Too flexible. Okay, there we go. But you can see the important parts there, and I can keep an eye on my chat. Okay, good. Thank you. So let's go over this together, y'all. These different parts. So looking at this, and I'm looking at my own notes here as well. A tuberosity, which is the first one listed. Or first, I should say that all of these little parts that we're going to talk about first are prominences. So these are parts of the bone that stick out. Here we go. And so I'll give you some notes on these as we go through. But you got it. Oh, I'm on group 4. So that's not a part that sticks out. Here we go. These are the parts that stick out. A tuberosity. So a tuberosity, as you put here, it's a large prominence. It's rounded and it tends to be kind of rough. So the example there is the tibial tuberosity. Yes. Yeah. Let me answer that question before we get into this. You can access these jams. Let me remind you of where that is. Let me just go to my screen here. Okay, can you guys see my Blackboard screen? Can you guys see my Blackboard screen? Yes. Okay, cool. Perfect. All right. So just to remind you of where these are, because they are in a little bit different spot. If you go into course content, it's going to make me log in. Okay. Okay, here we go. Course content. Unit. No, even before you go into a unit folder, if you scroll down, you're going to see I put them here for all of my classes. You'll only see your class, but you can see that this is the jam list. And so what I've created here is just a Google Doc. And the nice thing about that is that I can just continue to add links for these things to it. And so from the very beginning of the semester to now, anytime we do a jam, I put it on here. So this one will be towards the bottom. I think I already put it on here. Yeah, here we go. Bone growth and markings. Here we go. So there's the original one. So if you want a blank copy, you can open that and make a copy of it as it says here, and then that'll give you your own copy to play with. Or if you want one that's already been filled out, like the one we did today, you can just open your own jam for your class right here. So the link is right there. And as we do some more today, I'll continue to add those there. So that's a great resource for you guys if you want to just remember that that's there. Okay. Jumping back to, I guess it will just be here, and that will work too. Here we go, back to that jam. Oh, work is still continuing on the jam. So a tuberosity. A tuberosity does tend to be a little bit larger. It's a prominence, it's a little bit rounded, and it tends to be rough. And a great example is the tibial tuberosity. So let's go over and see what you guys labeled. Hopefully it's labeled on the tibia. I don't see it there, but where did you guys label a tuber? Oh, here we go. A tubercle, I believe, is a slightly different thing. So group 1, where did you label the tuberosity on the bones? It can be anywhere. There's tuberosities all over the place. There's some good ones on the pelvis too. Group 1, did you get to that part?
I think we forgot to do that.
You forgot to do it? Okay, I'll label
I think we
one
were
for you.
just worried. I mean, we did put a picture, but
on the chart.
Yeah, but
Okay.
I feel like I mean, we just overlooked that.
Okay, that's okay. Let's see then. So yes, yeah, you put that, there's a tibial tuberosity right there. And that's fine. If you guys want to include little pictures there, that's great. This is your jam. But let me show you on here what a tuberosity looks like. Okay, so one of the big skills here is going to be learning to recognize the bones as well. So this bone right here, this big old bone over here, that's the tibia. And there's this kind of roughened part that sticks out right there. And that is the tibial tuberosity. Grab my pen and I'll circle it for you. Here we go, right in here. This is one that you can actually feel. Whoop, made it a little bit big. You can actually feel that if you reach down. It's not your kneecap, but it's the front of your shin bone just below the knee, the little part that sticks out right there. That's below the kneecap. That is the tibial tuberosity. So you can feel that particular tuberosity. Okay, tibial tuberosity. Okay, next. Group 1, here we go. A little bit slow jumping around, but we'll get there. Number 2 is a crest. So a crest is exactly what it sounds like. It's a little ridge of bone that sticks out. It tends to stick out above other things. Very nice. And so, yes, you have a couple of really good ones on the pelvis. Let me show you that. Right up here, your hip bones that you put your hands on. That's this bone on the top, your hip bones. Oh, it's on the top, right up there. That's known as the issue, or the, losing my mind. Here we go. It's the ilium, the ilium. So this little ridge of bone up here at the top is known as the iliac crest, right up there, right up there. So when you put your hands on your hips and you're giving somebody a serious look, that is the iliac crest, I-L-I-A-C. And there are different crests, different places on the body. Okay, good. Next, we have a trochanter, and I see a femur there. Perfect. A trochanter is a large prominence. It's a large sticky outy part. The thing with the trochanter is that it's femur only. We only find these trochanters on the femur. So let's see here. So yes, trochanters. There's another part called a trochlea, and I was kind of getting confused with, or not getting confused, but trying to remember, make sure we're talking about those. So these little bumps that are pointed out here, those are tubercles, but like this guy, this big prominence that sticks out right up there, that is the superior trochanter, or the greater trochanter, greater trochanter. I'm having to dig these terms out of my memory too. And guys, I have to review this stuff too. Every semester I have to review it because, you know, you don't use it every day. I try to incorporate it into daily life. Like if I bump an elbow or something, I try to remember what that process is that I bumped, just because I know I'm going to need to know it. And you guys going into the healthcare profession definitely need to know it on a daily basis, but it takes practice. That's what I'm getting to. So that's a trochanter up there. And there's two of them. There's a greater and a lesser, and you only see them on the femur. Okay. So that one's kind of rare because most of these you can find on multiple bones, but that one, femur only. Next, we have a line. A line is what it sounds like. It's a little tiny ridge of bone. And a good example, there's a big line on the femur. You find big lines a lot on the long bones because those are great places to attach. Those are great places to attach ligaments and tendons and things like that, and muscles can attach there. So see this line running down. I'm blanking out on the name of that guy. Let me look it up. I made some notes. Okay. So actually, let me show you this one up here. So see this little ridge sticking up right there? That guy is called, I'll make a line to it, an intertrochanteric line. I don't know if that one's on your list, but it is a good example. And that's because in this case, it's between this greater trochanter and lesser trochanter down here. So we call it the intertrochanteric line. Okay, so again, the names of these things will often tell you what they are. Okay, moving on. I think that was all of group 1. Good job, group 1. Group 2, we're starting out with a tubercle. A tubercle. And a tubercle is a smaller prominence. It's a small kind of rounded bump that sticks out. So it's smaller than a tuberosity, for instance. Yeah, small and rounded. I'm checking my notes here. And the adductor tubercle is a great example. That is going to be, let's see. Thought I saw it here. Those are tubercles sticking out of the femur there as well. There we go. And down here, good. See that little bump that sticks out on the side? Not the whole big thing on the bottom, but that little bump that sticks out on the side of the femur on the left-hand side. That is called the adductor tubercle because an adductor muscle is going to attach to it. Okay, excellent. Oops, group 2. All right, next we have epicondyle. So obviously epi, this name tells you that this part's going to be above something else, and it's going to be above another kind of a prominence called a condyle. So here's a good example of one, the lateral epicondyle. And let's see, is that on? There it is. Awesome. Yeah, over here on the right-hand side, we've got the humerus bone. That's your upper arm bone. And it has a couple of good epicondyles. So we're not talking about the prominence on the, oh, yes, we are. Yes. So this part that's sticking out here, this is called the epicondyle. And the one facing out, like out on the shoulder side of your arm, is going to be the lateral. And the one that faces in towards your body is going to be the medial epicondyle. Okay, good. So they are going to fit above a couple parts in the elbow known as the condyles. And we'll see those in a little bit. All right, next a spine. So I know a spine sounds like the spine in your back, like your vertebral column, but that's a little different. A spine on a bone is a little spike that sticks out. So when you hear spine, think spike. And the ischial spine is a great example of that. Got three bones that make up the pelvis. The hip bones, which you put your hands on, is the ilium. Ilium or ilia are plural. Your butt bones down here that you sit on, those are called the ischia. So the ischial spine down here is right here. See that little part that sticks out right there? Boom, boom, kind of points back. That's called an ischial spine. And let's see, did you guys put, group 2, did you guys put another example of a spine? I just kind of jumped to this.
I don't think so.
Don't think so? Okay, because there are other spines, other places. Didn't want to skip y'all's example. All right, so spine sticking out. Okay, process. A process is kind of just a generic term for a part that sticks out. And so sometimes if something just has kind of a weird shape, but it sticks out, they'll just call it a process in general. So the spinous process. Yes, I know where that is. That's on a vertebrae. Yes, there you go. So here's a vertebrae. We're going to be learning the parts of those today. And the part that sticks up, that sticks directly out of your spine, that's another way to think of it too, is the spinous process. Okay, very good. Again, you'll see a lot of other terms are called processes because it's kind of just a generic term for a part that sticks out that has an unusual shape. All right, now jumping over to here. Here we have parts that that make, the first 4 here are parts that make up a joint. So this is where two bones are going to connect to one another. So first we have a ramus. A ramus is another word for a bridge. So I picture, you know, like a male goat or a male sheep is called a ram. So I picture a ram crossing a bridge, or maybe the truck, the Dodge Ram crossing a bridge, if that's helpful to you. Whatever gets you there, right? Okay, and down here, let me make this a little bigger so I can see a little bit better just for a second. Okay, the mandibular, oh, that's the notch, right? This part of the mandible down here, this is the bottom jaw. This long part that goes down from that notch is called a ramus, for one. These parts of the ischium down here that make a bridge between this part and this part, those are called rami as well. Group 2, group 3, did you guys put a diagram, a label of a ramus somewhere?
I did the ischial ramus.
Let's see, did I not?
It's on-
Oh, you mean on the, oh, here it is. Yeah, perfect. Yeah, so those bones there, there's 2 of them there. Yeah, so it makes a bridge, right? Good. Next, head. A head is a big round prominence. Usually it's on the proximal end of long bones, but there is one exception to that we'll see. But yeah, here, easiest one to find, that's the femoral head. That is the bone that goes into your hip joint, the ball and socket joint of your hip. So the head there. Humerus also has a head. The radius and ulna have heads. And usually they're closer on to your body. They're more proximal. But again, there is an exception to that we'll see. We'll talk about that next time. Good. A facet. Where have you guys heard the word facet before? Or have you heard the word facet before in everyday life or a non-anatomical context? If something is many faceted.
In sewing, there's a facet stitch. It's like a interlocking square stitch that typically is like on the edging of fabric.
Oh, nice. Does it kind of make, you said a square stitch, does it kind of make little panels that overlap?
Yes.
Okay, cool.
It's like squares on top of squares on top
Okay.
of squares. Yeah.
Interesting. That makes sense. Usually when I think of facet, I think of like a jewel. When a diamond is cut and it has little faces that reflect light, you call those facets. Or if you have a piece of stained glass, the little individual pieces of glass in that mosaic can be called a facet, faceted. So it's usually kind of a flat thing, but it's going to be smaller shapes within a larger shape. In this context, it's going to be something that's flat. So I think of it like the surface of a jewel, like a flattened, I think of it as being shiny, but they're not always shiny. Group 3, where did you guys label a facet? There's one. Boom. So see this on the vertebrae, the superior articular facet. This is going to be where this vertebrae connects to the vertebrae above it. So when this next vertebrae sits on top of it, it will sit against those little facets right there. So it makes a nice smooth area for connecting two bones. Okay. So a flat little dish. Cool, I didn't know about the facet stitch. That's interesting. All right, a condyle. So a condyle is, as it says here, a rounded prominence at the end of a bone. And since it makes up a joint, you know it's going to connect to another bone somewhere. Really good knee joint formed by, yeah, let's look at the knee joint. So remember there were parts called epicondyles. Yeah, so I'll show you here on the femur. We'll look around and see if there's some condyles labeled. Okay, but these are here for sure. These big round prominences, this is on your knee. This is the bone above your knee. Those are called condyles right there. There's a lateral and a medial condyle, which means outside and inside. There's one, okay. This is the elbow. So the medial condyle, yeah. These condyles are going, here they are, the rounded parts here. This is the humerus, going to fit against the ulna on the left and the radius on the right. So those are condyles as well. Let me put them on here too, because these are just two really big ones that you'll see. This guy, for instance, right here. Give me a pen, come on. Right there. Now that's on the part that's away from the hip joint, right? So that's how I know that that particular one is a lateral condyle. Over here. Quit that. The lateral condyle. So it's a big round part that makes up a joint. Oftentimes it's like a hinge joint because you do see it in the knee and you see it in the elbow as well. Excellent, excellent. Next we have a fossa. Fossa is technically in a different category. Fossa, maybe I'll put a line across there to emphasize that. A fossa here is, ooh, I don't know if I'm helping or hurting. A fossa is going to be a type of depression. So when I think fossa, I think of like a fossil dig. And when they dig out fossils, they'll make a little depression or a bowl in the ground and they dig the bones and the fossils out of that, right? That's one way to do it. So it's a depression. Intercondylar fossa. Right there on that femur again, we've got a condyle. That little dish in between is an intercondylar fossa. Okay, so it's a little dish. Very good, group 3. All right, one more, group 4. A sinus. So again, this whole page, we're talking about depressions or things that sink into a bone. So a sinus is like a little cave, a cavity inside a bone, and usually it's going to be lined with mucous membrane. So yeah, all of these spaces inside the face here, those are sinuses. Those are nasal sinus, or there's a bunch of different names, but the one in your forehead, if you didn't know, you have a little space inside your forehead. Those are called frontal sinuses. Very nice. A meatus. A meatus is like a canal. It's like a tube. So probably the easiest one to find. Let's see where you guys put it. Temporal bone, mastoid process. Where did you guys put meatus? There is more than one.
External auditory canal, I believe. Or
Okay.
the auditory meatus.
Let's see if it's labeled.
It's really small. I was trying to get out of the way of the people labeling the bones of the skull. So I tried to make it
Okay.
really small. It's right there next to it, though. It's a
Oh, it
tiny
is.
yellow sticky note.
Let's put a little arrow right there. Yeah. External auditory meatus. Good. It's the same word as ear hole. Don't put ear hole on the test. It's also known as the external acoustic meatus, but it's the canal, it's your ear hole. So it goes through the bones of the skull, through the temporal bone, and leads into the middle and inner ear. So meatus is like a canal. I think meaty meatus, I don't know, like a meaty ear, if that helps. A foramen. A foramen is absolutely a hole. Oftentimes it's oval shaped. Yeah, but not always. Easiest foramen to find, boom, right there. Look at that giant guy. The hole in your skull that through which your spinal cord runs, the connection between your brain stem and your spinal cord, is called the Foramen Magnum, which literally means big hole. Hole big is what that means. Okay, but there are forama all over the place. There's up a little further right and here. You can see there's holes underneath the skull. And so that one, for instance, is called the carotid foramen, through which your carotid arteries run. So there are it's not foramens, foramina, all over the place. All right, last two, a fissure and a notch. Okay, a fissure is exactly what it sounds like. If you saw a fissure in the earth, you'd see a crack in the earth. So it tends to be an elongated opening. And then a notch is just a notch. It's kind of a rounded depression. So let's take a look, usually on the edge of something. So here we have on the mandible and the jaw, we have the mandibular notch. That's an excellent notch. So again, a rounded depression on the edge of a bone. And the other was a fissure. Where did you guys label the fissure? I know there's one in the back of the eye that's really nice. Group 4, do you remember where you labeled a fissure? Okay, let's see, trochlear fossa, posterior, middle, and anterior. I think you guys put examples of fossas on your chart instead of fissures. I think you got your words confused, which, boy, that can happen. So you might want to change that. I'll put a little X on there. Change that. In the meantime, I will show you a really good example of a fissure. So if you look here in the back of the eye, see if I can outline it with my mouse. See this big giant crack? That's called the optic fissure. And so that's in the back of the orbit, and that's the area that allows nerves, blood vessels, some muscle attachments, possibly from the eyeball to pass further into the skull. So that guy is called the optic fissure. It's like a crack. It's not just a hole. It's not just a tube. Optic. Optic fissure back there. Okay, good. All right, so I want to ask you guys 2 questions at this point. I know we took some time with this, but if you start to get these terms down, it's going to make it a heck of a lot easier to learn the rest of the bones, which you're going to have to do in fairly short order. So 2 questions for you. What was my first question? 1, do you guys have any memory tricks, anything that pops up for helping you remember this? Anything you came up with for any of these terms? No, none that come up? Okay, well, if any come up as you guys are working and in group work as well, like, you know how I remember this? I think blah. When I think tuberosity, I think about a tuber, which is like a potato. Maybe it's kind of a rough potato shape. Whatever works for you guys, okay? And I can't remember what my second question was for that, but I wanted to see if any of you guys had any memory tricks that you knew of for these. All right, any questions about any of these parts before we move on? Now you have a nice little reference guide. If you're trying to remember what the heck is a crest, you can go back and look it up and start putting these pieces together. Okay, in that case, I'm going to switch screens here. We're going to switch topics entirely, and we're going to go over and do the last little chunk of chapter 6. Excuse me. Which is going to be about bone damage and disorders. And then we'll come back to the skeleton. I just don't want to do too many skeletal parts at once, right? Let me see if this will allow me to make this a little bigger. Nah, it's about as big as it's going to go. Okay. So hopefully that doesn't look too tiny on your screen. Let me do it this way. Nope, that's as big as it's going to go. Okay, that's fine. You go back and share it. All right. So just to confirm, you guys, you can see, oh my goodness. You can now see the PowerPoint?
Yes.
Okay, awesome. Thank you. I know you guys are gonna get tired of me confirming, but I want to make sure. Oh my goodness. Better to confirm than to talk off and y'all aren't seeing what I'm supposed to show you. All right. And just to confirm this, let me make sure you can see me drawing on the screen. I just drew a pink squiggle.
Yes.
Okay, perfect. Thank you. Okay, so for the rest of our time for the first half of class, I want to talk to you about these bone disorders a little bit and bone damage, and then we'll take a break. And I think this section is interesting. Now, I should preface this and say that, you know, when we talk about disorders and damage, I will refer to them as being really interesting. And on paper they are, but of course I do acknowledge that when we talk about damage and disorders, these are actual people we're talking about, right? That they're not so interesting to the people that have them. They might be interesting on paper, but that these things do, of course, cause suffering. So I do acknowledge that. So forgive me if I say, isn't that interesting? And it's some horrible disease. Okay. Biologically, it's interesting. And the thing I like about talking about disorders like this is that it links directly to what we've learned already about the function of these tissues, how they work, how they get remodeled, all of that stuff. Okay. So let's talk about these. So first we have bone damage, fractures. A fracture is any kind of a crack or a breakage in a bone, of course. And there's lots of different kinds of fractures. So let's go through the different categories of fractures. First, we have non-displaced and displaced. And these are classifications based on the ends of the bone. So are the ends of the bone still in alignment or not? We can also classify fractures based on whether the break goes all the way through, which we call complete, or whether the break just goes in a little bit, if it's just a little crack in it that doesn't go all the way through the bone. So we can call it a complete fracture or an incomplete fracture. Over here, we're looking at a fracture of a wrist, an X-ray there. How would you guys classify this in terms of position of the bone ends? How would you guys classify that? Keeping an eye on my chat as well. It's definitely displaced. Yeah, see how the bone no longer lines up? This is the end of the radius over here, and it's just completely out of alignment. Yes, and also good. It is also, we would call it, wait, would we call that incomplete or complete? What do you guys think? That's okay. Yeah, it's a complete fracture because it's completely broken through. It's not just a little like little crack in it, it's all the way broken through. That's a pretty nasty break. That will require surgery, likely. Another way to classify these is either as linear or transverse. So linear runs with the line of the bone. Transverse goes across the transverse plane of the bone. You can also call it compound or simple, depending on whether the skin is penetrated or not. So how would you guys classify this break over here? We have two long bones. Let's see if we can scoot that out of the way anymore. Oops. Simple and transverse, you got it. So it's simple. You can kind of see kind of the ghost of the skin around. And so you can see it's not really penetrating the skin. So it would be simple. And it's transverse. It's running along the transverse plane. A linear break would be running along the line of the bone. So maybe a crack like that would be a linear. This is definitely a transverse. All right, good. Before I move on, let me see if I can scooch that. Silly menu out of the way. There we go. That's, yeah, it'll work. Okay, next. So when fractures are repaired, typically the technique that's used is to take two steps, at least initially. First, you want to reduce a fracture, and reduce means to set the bone, right? To bring the bones back into alignment. I tried to find a picture from an old-timey Western movie where they do this, because you'd see that all the time, right? Your leg's broke. Bite down on this piece of wood and we're going to pull it and pop it back into place. It's not that simple. There is a lot of technique to reducing a bone properly, and you can really mess up someone's limb bone or whatever you're trying to set if you don't know what you're doing. But here you can see that here they're reducing a fracture, and the bone has to be pulled and twisted just in the right way to kind of bring these back into alignment. And then after that, you immobilize it, right? You can put a stent is not the right word. I'm forgetting the word for that. Anyway, you could brace this by putting something hard against it, or that's what the cast or a boot or an immobilizer will do as well. We'll wrap around it and just hold it in place, hold it still, and keep it in alignment. Sometimes surgery is required for this. Sometimes if a bone is really badly broken, they will reduce it by putting in pins or screws or other devices to hold it in place. or sometimes like they'll run a long wire down the length of the bone. There's all kinds of interesting techniques for that. All right, next, let's talk about what happens when a bone is broken. How does it heal? So the first step is called a hematoma formation. And as it says here, this will be immediately after the break has occurred. So this area is there will likely be broken blood vessels, so the area is going to be bleeding a lot. You'll have a lot of inflammation in this area. So the area swells up. If the periosteum is still in place, it will kind of contain that area. And so you get a big lump on the bone. A lot of damaged tissue in there, a lot of inflammation, a lot of water and blood retention in that area. So the immune system will come and start cleaning up this area. Now, eventually, depending on how bad the break is, some chondrocytes will come into the area and they will start to build some fibrocartilage in this area. So they'll make a little pad of fibrocartilage in the break. And we call that a callus, Fibrocartilaginous Callus. Sometimes this area is also called, or this structure is called the soft callus. Okay, it's not reformed bone. It's just a basic repair. Okay, next, the third step is when osteocytes, bone cells, start to come in, and they will do kind of what they do in the long bones when they're growing. Remember how your long bones have a piece of cartilage in there, and the cartilage grows, and then the bone gradually replaces it. Well, the same kind of remodeling process will begin here. The bone cells will come in and will start to build just some bone in that space. And it'll be fairly disorganized at first, but it is bone. The secretion of the calcium will kill off that cartilage, so the cartilage will disappear. You can see the swellings beginning to go down in that area as well. And that thing is called a bony callus. So the soft callus gets replaced by a bony callus. And then gradually over time, the machinery of the bones, the osteoclasts and osteoblasts, will come in and they will reshape this structure so that you have compact bone towards the outside in the proper places, and you have spongy bone in the middle. Blood vessels will heal and bring in additional resources, and it will reshape the bone. Okay, any questions about the 4 basic steps of how a bone heals after a break? It's the same basic process with cartilage, osteoblasts, and osteoclasts. It's just used in a different context. Okay. Next, I want to talk to you guys about a few different bone disorders. So these are diseases and disorders. They fall into 2 categories. There are congenital disorders and there are acquired. What does congenital mean? What does that word mean? What does the word congenital mean? Born with it. Yeah. Oftentimes genetic. Yeah, congenital, you had this. Acquired means that it came on during your lifetime at some point. So first, let's talk about a few congenital disorders. These are, again, things people are born with, things that are typically genetic. Osteogenesis Imperfecta. Again, I will refer to these as interesting. They are interesting. But this one is known as brittle bone disease. You often see this in children, and these poor children, their bones are just very, very fragile and they break constantly. And you can see that as they grow, they just aren't very strong. So they bow and they have unusual shapes. They don't support weight well. Often requires lots and lots of surgeries to repair breakages and things. So what's causing this? Well, this has to do with the machinery of the bones that lay down matrix, and specifically that lay down the collagen fibers. So there is something, I don't want to say wrong, but anyway, something wrong with the structure of the collagen fiber. And so the collagen's not very strong. It doesn't get laid down in the right pattern. So the matrix of the bone is not getting laid down properly. And so that causes these kind of soft, brittle bones. Another interesting symptom of osteogenesis imperfecta can be seen in the eyes. So remember that collagen is the most common protein in the body. It's everywhere. It's in all your connective tissues. And so the sclera, the white of the eye, contains a lot of collagen. Because of this misshapen collagen, it makes the sclera look blue. So blue scleras is a symptom of this particular disorder. All right, next we have achondroplasia. The sort of generic term for this would be a form of dwarfism. Okay, achondroplasic dwarfism. There are a number of things that can cause, there's different kinds of dwarfisms. This is strongly genetic. It's caused by a dominant trait. So when it occurs in families, it tends to show up either as, if someone inherits the gene for this from both parents, typically they don't make it to term. So miscarriages in that case. But if an individual just inherits one of these dominant genes from one parent, it can result in this dwarfism, achondroplasia. So what's going on there? Well, let's think about it. In this case, people with this disorder don't make this chemical known as fibroblast growth factor. So the fibroblasts that form connective tissue are going to be suppressed. They're not going to be very active. Specifically, it's going to inhibit the chondrocytes. So even though this child can grow a skeleton, they have difficulty growing the cartilaginous parts. And remember, the long bones of the body depend on a cartilage framework to be built first. So if the chondrocytes are inhibited, it's going to give the person trouble growing that skeleton, growing the shape of the skeleton. So the long bones tend to be kind of shortened. They don't lengthen at the correct rate. They tend to stay kind of small over time. So that's a cartilage issue. Think of it as a bone issue, but really it's a cartilage issue. All right. This one is petrosis, not osteoporosis, which is different. Osteopetrosis. So this is an issue. It is genetic as well. But this is an issue with the bone remodeling process. Okay. And in this process, again, in this disease, the osteoclasts are being inhibited. So the osteoclasts, if you remember, break down bone. So you're going to have your builders working overtime, but your breaker downers, remember Bob and Claude? Claude is not going to be working very well in this system. So what that results in is bone that tends to build up in certain areas and be kind of thickened. So you can see that in this area, this is part of the femur. The femur does have kind of a thick end on it, but usually not quite this thick. We've got some thickening happening in this particular part of the bone. And even though the bones are bigger and thicker, they're not structurally as sound, because the shape is not quite correct. All right, now we're going to talk about some bone disorders that are acquired. These are also known as metabolic. Remember that in science, metabolic basically just means, that's hard to see. there's some problem with the chemical reactions inside the cell. Okay, some cycle of chemicals that's been thrown off. The homeostatic imbalance, or there is an imbalance in the homeostatic pathways. Because metabolism means all the chemical reactions inside a cell. It's not just diet or dietary. First, the most common one that you hear about, osteoporosis. Osteoporosis. So this is a gradual thinning of the bone tissue. You can see here in this bone that the spongy bone, the trabeculae in here, are a lot finer and thinner in the head of this femur than in this one, in the normal one. This is the hip bone here, okay, the top of your leg. So what causes this? Well, this tends to come on with age, but there are a lot of factors that can affect the onset of osteoporosis. There are some genetic factors that can make people a little bit more prone to this, but there's a lot of lifestyle things too. Age, over 40, this tends to be, bone density loss tends to be more of a problem. Gender can affect it. Who has more of a problem with osteoporosis, guys? Is it males or females? What do you guys think?
Females.
Females. Oh, I know. I'm starting to have to do bone density checks. It makes me feel old, but important. Yeah. And that's because these are often associated with changes in sex hormones, which that happens. The sex hormones in our bodies change when we hit menopause. So, you know, men don't hit menopause, so they don't have that big shift in sex hormones. So that can affect this. Exercise also can affect this. If you don't exercise, you don't work your bones, you don't put stress on it, then they tend to get kind of smaller and be a little bit weaker anyway. And so this thinning can accelerate in there as well. Diet. If you don't have a diet if you don't get any calcium or any vitamins, especially vitamin D, that can kind of contribute to this as well. Exposure to different kinds of chemicals can do it. Medications can contribute to this, like steroid hormones. If you're taking steroid hormones for inflammation or for asthma, those things can contribute to this. Now, if you're taking those medications and you're pretty young, it's usually not a big deal, but as you get older, you have to watch out for this. This isn't a disorder that hurts, so someone won't even know that they have this, but the problem is that it makes you much more likely to have a fracture, and it slows down the healing process. And they almost always show the hip or the femur, because this little neck in here, this is the head of the femur, and here's the neck. That little neck becomes very susceptible to breaks, and that's what we actually refer to as a broken hip. It's not the pelvis bone usually that breaks, it's this bone that breaks right there. Here you can see two types of tissue. You can see the normal tissue of the neck of the femur, and then this is the thinned tissue. You can see how spacious those holes are in there. Osteoporosis can lead to a kind of collapse of the spinal column over time. So you can see how the spinal column just can't support the weight of the body as well as the bone becomes thinner and thinner. And so you get this kind of exaggerated S-shaped curve, the kind of humpback in later stages of this. And you can see on the bottom how the thinning of the bone has continued from left to right. Okay. Another acquired disease, this one, we call it acquired. Again, it's because it tends to develop later in life, but Paget's disease, or Paget's disease, does have some genetic components. They have identified some genes for this that run in family lines. There's also some debate as to whether a type of virus might contribute to this. So it may be a viral infection that kind of kicks this off. So that's kind of an interesting connection. But the cause of it's highly debated. Don't really know why it just starts. But this is an issue with the bone remodeling process. And as it says here, the bone remodeling is just not synchronized. So it's not that the osteoblasts aren't working or the clasts aren't working. It's just they're not working together very well. So the blasts will start building, the clasts will start breaking down, but it's not organized. So it's kind of random. This can cause deformities of the bones, which can weaken them and an increased risk of fractures as well. Here's kind of a neat slide that goes along with Paget's disease. This is a cross-section of the diaphysis of a long bone. It's the shaft of a long bone. And see these little white patches in here? Those are called woolly or cotton patches. And they indicate that bone remodeling is happening in a random pattern in here. So the structure of the bone here has been compromised. You can also see how wide the medullary cavity on this bone is. It's huge compared to the wall of the bone. And so that's something that happens with this too. The bones tend to get thinner, kind of wider in diameter and a lot thinner, which makes them unsound. Next, we have rickets. Rickets can also result in a deformity. And notice that when we talk about deformity, we often talk about the leg bones. You can see the curvature in the leg bones, and that's because the leg bones support a lot of weight. So that's why we tend to see it more in the legs than in the arms. But it can occur anywhere in the body. Rickets is also known as osteomalacia. When this occurs in adults, we call it osteomalacia. When it happens in children, it's often called rickets. So this is caused by often a dietary lack of vitamin D. Sometimes calcium, sometimes other minerals and things can do it too, but mainly it's a vitamin D deficiency. So remember that vitamin D has a lot to do with bone remodeling, and it helps the cells lay down not the matrix so much, but the calcium phosphate crystals, mineralization of the bone, making it hard. So when you have a problem with mineralization, the bones, as they grow, you'll lay down a lot of matrix, a lot of that osteoid, as it's called, but the tissue doesn't harden very well. So you can get these kind of deformed bones. One of the nice things about rickets is that if you catch it in children, it can generally be reversed. Because their little bodies are still growing, oftentimes with proper nutrition and with exercise, exposure to sunlight, things like that, these bones can straighten up over time. Again, it's one of the reasons why we have vitamin D enhanced milk in this country, is to help with rickets. Don't see it much in North America very much, but it's still pretty common in some parts of the world. Is this the last one? Yeah. All right. One final disease that we will talk about is hyperparathyroidism. So for this, we have to think about the function of the thyroid and the parathyroid. Okay, so let's go back to, I think I mentioned it really fast last time, but let's talk about this a little bit. And here we're talking about the regulation of blood calcium by the thyroid and the parathyroid. See if you can remember. Again, I zipped through it last time, but is the thyroid stimulated by a rise in calcium in the blood or a drop in calcium in the blood? What stimulates the thyroid, a rise or a drop? A rise, you got it. So calcium levels are going up. It will then release a chemical called calcitonin. Yes, calcitonin. I had to think about it, make sure I'm saying the right words. And in response, the blood calcium level will come back down. So if there's too much calcium in the blood, it will bring it down. Now, when it does that, is it going to build bone or break down bone? If you want to lower the calcium that's in the blood, are you going to build or break bone? Oh, you guys are on it. Good. So the thyroid generally is going to stimulate the building of bone. Which cells would that be? What's its? Blasts. Good, guys. Excellent. So they will stimulate the osteoblasts. So if you have hyperthyroidism, that can sometimes cause overstimulation of the osteoblasts and cause problems. Now with the parathyroid, and it has an even bigger control over this than the thyroid does. What's the stimulus going to be? Will it be stimulated by a rise or fall in blood calcium levels? Good, good. When calcium levels are falling in the blood, the parathyroid is stimulated. It'll cause a series of events, and so it will cause the blood calcium to go back up to balance it out. It's going to be the opposite. This is going to involve the breaking of bone, which will be the class. You got it. So if you have hyperparathyroidism, hyper means above, that means that your parathyroid's going to be producing too much PTH, parathyroid hormone, which will stimulate those class, which will break down the bone and release the calcium into the blood. So your bone gets broken down too fast. And so that, of course, can result in fragile bones. If you have hyperthyroidism, it'll be the opposite. Although it doesn't just strengthen your bones, it just kind of messes up the matrix to have too much bone being built. You can also have hypo of either of those. Hypo would be too little of either of those hormones, can have effects as well. Okay, any questions about those? This is a nice little video if you want to watch it. It goes into great detail about these different diseases, and it talks about treatments and clinical tests and all kinds of good stuff. It's not testable material, it's just interesting. Okay, y'all, I know I went over time by quite a bit there, but we're making progress. We're getting caught up from last time. Oh, come on, stop screen. It's trying to be so helpful. Here we go. All right, any questions about those disorders? I think they're super interesting. That is testable material. Not a whole lot, but I may put a matching on your test or something about it. Devote the whole next class period to skeleton, to finishing up the skeleton. All right, so first, let's see, that's immediately in my way. Good enough, let's roll. So we're talking about the two divisions of the skeleton. Today we're going to do the axial. And the axial skeleton is shown in blue on this diagram. It's the skull, the vertebral column, the rib cage. Lots and lots of bones to know on the skull. I think there's 22 individual bones to know. And the real challenge with those is to recognize them from different angles. So if you're looking at them from the front of the skeleton, that's one thing. If you're looking from a lateral view from the side or below or above the skull, you still need to be able to recognize those same bones. So let's see what we can do about that and go through it. I also have a nice video that I will recommend to you. Stick that up there, maybe. It bothers me, it's on my screen. Here we go. Okay. All right, so first we're going to talk about the cranial bones. So these are the bones that enclose your brain. So they're the ones on the front and the back of the skull that you can see here, but also some of these that are in the back of the eye that you can see through the orbit. Those are cranial bones as well. And then these others are facial bones. Some of these bones are big and nice and easy to see, and some are smaller and have a really weird shape. And they all have parts. So if we look inside the skull, you can see that there are different cavities or spaces inside. So it's not just a solid chunk of stuff. It's mainly space. This is the cranial cavity where the brain goes. The orbital cavity is where the eyes are. You also have a bunch of nasal sinuses. Different sinuses are just enclosed little caves in here. And then the oral cavity, of course, is the mouth. If we could see this from the side, we'd also see that there's a space in laterally where the middle and inner ear are housed. So there's caves in there as well. All right, major bones, here we go. And I'm going to try and be brief, which is difficult for me. This bone on the front, forehead, frontal. Pretty easy. Frontal, forehead. This guy is the big blue one. You have two of these. You have one on each side of your head. These are called the parietal bones, or parietal, if you want to say it that way. Parietal or parietal covers the top roof of your skull. In the back, we have this purple guy. This is the occipital or occipital, if you want to say it that way. This covers up the area of the brain that has to do with vision, believe it or not. So a lot of your visual memory and your visual processing is in the brain under that bone. That's the occipital. On the side, where your temples are, we have the temporal. And you do have two of those, one on each side. These two are hard to see. This guy is called the sphenoid. And from another view, it looks like a bat. And so this is one of the wings of the bat sticking out from behind your eye socket there. So we'll take a look at him from another view. And then ethmoid, you can see a little teeny piece of it peeking out here. It's this kind of greenish in the eye socket. It makes up the back of your nose, the part of your nose that you can't see unless you look up your nose. Okay, but it makes up a little tiny bit of the cranium as well. Okay, frontal, parietal, occipital, temporals on your temples. That one's pretty easy. Sphenoid goes behind your eyes. Ethmoid is the back of your nose. Let's look at them from some other angles. Yeah, here's where it gets tricky, right? When you flip the skull over. So, okay, this is the anterior view. Here's ant up here. Here's posterior view. So internally, you guys tell me, what do you think? What are these big reddish pink bones up here on the front? You got it. Frontal. Little trickier to see from this view, but these would wrap over the top of the head. What are these blue ones shown on the side here? Like right there. Oh, we have some debates. Oh, these guys, remember we're looking from the top. This is a superior view. These are the parietal or parietal bones. Just below it, the tan here, they won't always be tan, but tan temporal. That's the temples. So these parietal would wrap over the top of the skull, all the way to the top. The temples are kind of on the sides. So parietal's there, temporal is there. What about this bone on the back? Is that what, lavender? Yeah, you got it. Occipital. Occipital. Notice that the occipital bone wraps all the way under the skull, and it makes this feature here that's really important. This is the foramen magnum. The big hole. Foramen Magnum is the name of that. That your spinal cord passes from your brainstem out through that hole and into the vertebrae. So maybe occipital and it's got a big O in it. Maybe that's handy. This little chunk up here is part of the ethmoid. So this is the bone that goes behind, that makes up the back of your nose and part of the divider of your nose. And then it extends up here into the cranial cavity. This little part that you're seeing in the middle, I imagine that it's a diamond shape. It's a little feature called the crista galli. And so I imagine like if you were on a treasure hunt and suddenly you came into this giant cave that is the cranium, if you find a crystal in there, it's the crista galli. This is also, it sticks up, it's like a little fin. This is the part that if you've heard, if you hit someone in the nose just right, you can drive their nose bone into their brain. That's the crista galli that's most likely to do that. Extends from the nose up into the brain cavity. There's some important structures on the side that we'll talk about as well. And then here, look at this, you can see the bat here. Is there a question? Make sure your mics are muted, guys. We can hear somebody humming. Okay, that guy, see that big bat in the middle? Or it kind of looks like an elephant without a trunk from this view. That's the sphenoid. You might also think of it as like a ghost, like an old-timey ghost. So a specter, sphenoid. Okay, this makes up the bottom of the cranial cavity. There's a couple of important regions on here. So since we're looking at the sphenoid, let's talk about that. Right here, there's a little depression. It's called the sella turica. I had to think about it. Sella turica. That term literally means Turk's saddle. It's like a Turkish saddle that one might ride a horse with. Sorry if you can hear the garbage trucks outside. But the pituitary gland of the brain sits right in there. We'll see that when we get to the brain. It's like a little bean that just, it's got a little cavity right there for it. Sella turica. The other part that's important is kind of right in here, this little hole. That guy is called the optic foramen. And that's where the nerves from the eyes enter the brain. Okay. So your eye nerves from the eyeball come in through that little hole. That's in the sphenoid. All right, here we're looking at it from the inferior view. So let's go over them again. I'll erase all the words. Let's do it again. Those who are participating. This is all. Let's start here. What's this big pink bone in the back? It's good practice for you to retype these anyway. Big pink bone, lavender bone in the back. Occipital. Occipital. How about these bones on the sides? The tan bones. Temporal. They're not always tan, but for now you can think tan temporal. How about the blue ones that are peeking out there? These blue guys. Parietal Periadole. That's them. There's two of them, one on either side. Looking from the bottom, it's got a little bit of a different shape. You guys see the bat right here? My tracing's going a little crazy. Yeah, right in there. Sphenoid, good. Can't see the ethmoid from here. It's like up and behind. Okay. Okay, those are the ones you can see from the bottom. So like I said, take this in small chunks. I'm just going to practice my cranial bones today and just go over those, take a break, do something else. Here's a labeled version. Yeah, we already looked at that view. Okay, let's talk about the ethmoid bone just a little bit more, and then we'll get back to some of those other views. And this ethmoid bone, look at that weird shape. This is the back of your nose. The bones on the front of your nose that kind of stick out of your face, those are called the nasal, but behind that we got this thing. And this makes up a big part of the divider between the right and left side of your nose. And it makes these weird little scrolly things in here that help move the air around. So like here, see this little flap? There's another little flap. These are called the nasal conkey or conchi, and they're kind of spirally, so they're shaped a little bit like a snail shell, a conch shell or conch shell. So as air comes in, it helps kind of move it around, and it aids your sense of smell. It aids your sense of smell. From here, from that view, you can see them inside the nose. Those are the inferior, and here these are the medial or the middle conchi. The upper ones are really hard to see. You can see that it does make this big divider here. See this? Maybe yellow would be better. There's a big divider here. This is called the perpendicular plate that sticks down. And then here's our little shark fin. That's that crystal, the crista galli, that sticks up into the brain cavity. Here you can see it on this diagram sticking up into the brain cavity. Okay, so that's the ethmoid. Weird, irregular bone for sure. If we look at the nasal septum from the side, this is the divider that separates the left and the right sides of your nose. And you can see that that plate that looks like, come on, go back. Here we go. The plate down here that just looks like a spike sticking down, it really, from the side, it's really a plate. So you can see it here. There are a couple of other bones that contribute to this. One of them is called the vomer. And then the front part is all cartilage. Remember the front of your nose is all hyaline cartilage. And so there's a divider in there in the middle that you can kind of feel, right? That's what the front of your nose is a divider of cartilage. See, the bone doesn't start until way up at the top. Okay. Oops, I'm just drawing dots. It's not letting me do what I feel like. What's going on? There we go. Okay. One more little note about that ethmoid. Do you guys see up here at the top? Here's that crista galli, the magic crystal. And to either side, we have these little areas that look like a filter. Looks like a little piece of sponge right there. That's called a cribriform plate. Cribriform plate is the weird name for that. But let's see what it's for, because it's kind of cool. So in your brain, you have this area that stretches forward, and I'll color it in kind of, maybe blue is a good idea here. Pen is being weird. There we go. This section right here, see that? That's called an olfactory bulb. That's a part of your brain, and it extends forward. And then look what happens. All of these little nose nerves, olfactory nerves that collect information on smell, they reach down through all of those tiny little holes in that spongy, here it is, cribriform plate. And so that's a direct connection between your the sensory nerves in your upper nasal passages and your brain. It goes directly into your brain, and it goes through those tiny little holes, which are called olfactory foramina and that cribriform plate. So I think this is really cool. I don't know, I'm always impressed by that. All right. I know I'm going kind of fast. We just don't have a ton of time, and I have a tendency to overtalk this stuff. Okay. So these big cranial bones, they are flat bones. They are, most of them, they are joined together by sutures. Sutures are a special kind of joint. When you are a child, these sutures have cartilage in them. They have hyaline cartilage in them. just like your long bones have chunks of hyaline cartilage in them, and that allows the bones to grow. So that's how a skull gets bigger, okay, is by the growth here. When you become an adult, these seal up. When you're really little, when you're a baby, there will be big chunks of cartilage in these spaces. I want to say they're called fontanella. I may be using the wrong word there. But anyway, those are the soft spots in a baby's skull, and they seal up with bone when you become an adult. So these sutures all have names. Let's talk about them. This one that I've just drawn that goes between the frontal and the two parietals is called coronal, because it goes along the coronal plane. This guy between the two parietals is called the sagittal suture, because it goes along the sagittal plane. Same names as the planes. That part's pretty easy. Looking from the back of the skull, this guy's a little bit, it's got a weird name. See how it makes kind of a peace sign? There is a Greek symbol, I don't know if I can draw it correctly, kind of like that. Oh, that's called a lambda. A lambda. And so someone thought that that suture looked like a lambda back here, where the sagittal meets this one going across. So this guy is called the lambdoid suture. Technically, it's the part that goes transverse across here between the occipital and the parietal bones. Couple of other sutures. Here's the last one. Squamous. There is a bone called a squamous bone. I don't think that one's on your list for this, but it's this suture that goes along your temple, between the temporal and the other bones there. That's called the squamous suture. Okay, squamous suture. While we are looking at this view, I want to tell you a few of the features of the temporal bone. We talked about the occipital a little bit, and the sphenoid and the ethmoid, but let's talk about this temporal a little bit more. Do I have a side view that's blank? Apparently not. Okay. Enough flipping around. We'll just use this one. All right. Let's look at this temporal bone here, this tan temporal. It's got some important stuff. So this bone in the front, the green here, I'll put a big Z on it. It's called a zygomatic bone. So I think zygomatic sounds like automatic, like some kind of machine. So I think of it as like maybe some kind of machine that's cranking out cheeks or something. This is your cheekbone. Maybe it's cranking out smiles. Wow, that's sappy. Zygomatic, smile-o-matic machine. Okay, so this bone in front is the zygomatic bone. This long structure that reaches back and attaches to the temporal, that's the process, the zygomatic process. Here it is, zygomatic process. And then the part in front is the bone. So zygomatic, zygomatic. Collectively, that makes up the zygomatic arch. Okay. Other features of the temporal bone. Here we have that ear hole again. Again, that is the acoustic auditory meatus, or the external auditory meatus. No, I think I said it wrong. External acoustic or external auditory meatus, the ear hole. Right there, big, easy to see. Yeah, that's it. I feel like I colored the wrong thing, but ear hole. Just behind the ear hole is this big triangle. And so I encourage you guys, take a moment and reach back behind your ear. You can feel that triangle sticking down. It's right behind your ear, and you can feel it. This is called the mastoid process. Mastoid process. It's a major connection point for your jaw muscles. So sometimes, a little bit. And your neck muscles. You're going to have big neck muscles that connect to this thing, that go down. So that's the mastoid process, massive mastoid. You can think of it because it's kind of big. This little guy, little pointy here, this guy is called the, here it is, styloid process. Can you think of a word that sounds like styloid, that's something kind of pointy? Something pointy that looks like, that sounds like styloid. A stylus, yeah. If you have a stylus that you poke at a touch screen with, it just means something pointy. So this little pointy part sticks down. That's the temporal as well. Connects to the temporal bone. While I'm on the subject, let me find another view from beneath. Here we go. One other really important part of the temporal is this right in here. The ear hole will be over here. You can't really see it, but right in here, this guy, that is the carotid foramen. Carotid foramen, or carotid canal, sometimes it's called. Do you guys know what the carotid is? What's a carotid? A carotid what? Artery, right. You've got a giant artery that runs up your throat, and this is where it goes into the skull. There's also an opening kind of behind it that you can't see from this angle. It's the jugular foramen, and that lets the big giant jugular vein come out. So they kind of run the same direction. So that's another one to look for. Okay, a lot of stuff on the temporal bone. Oh, also one other feature. On the occipital here, you've got these two, see these little plates right here? These actually are bumps that kind of stick out. Those are called occipital condyles. And those are going to fit against the vertebrae to make the neck joint. So those are an important joint right there. Yes. See, my other classes let out at 50, 10 minutes too. So, so I either keep trying to keep you guys late or trying to let you out early. All right, thank you. Let's continue with the face then. Let's add the face to the rest of the skull. So here we have that front view here too. Let's review this. What is this big bone? What's the big bone of the forehead again, guys? Oh, and I see the chat just popped up. Thank you, guys. Frontal. How about these little blue ones poking out here? They will wrap over the whole top of the skull behind the frontal. Parietal, or parietal's above the frontal. So parietal from the side, that will wrap up and over the skull to the top, to the squamous suture. How about these tan guys on the side? That's okay. Just guess away. This is just practice. Temporal, temples. Now from the front, we can see a couple of those other bones. This, in the eye socket here, you can see the frontal poking down. Let's see. This purple in the back, that's a part of the bat wing sticking down. That's the sphenoid. Makes up the back of the eye socket. This, what do you call that cheekbone? What's the cheekbone? It starts with a Z. Zygomatic. The smile machine. That's so dumb. That makes me cringe a little bit. Smile machine. Cheekbones and smiles. Anyway, you can see the zygomatic bone. It actually arches back a little bit, and it makes up part of the wall of the eye here too. Zygomatic. The rest of these bones that you can see in the eyes are going to be facial bones. So that's what we're going to talk about here. And the zygomatic's technically a facial bone too. Okay. You can see here's a list of them. Let's start here. Let's start with an easy one. Oh, this bone that makes up the bridge of your nose, nasal. Easy peasy. Those purpley guys right there, that's the nasal bones. This big bone that makes up the your top lip right here. You can see it extends up and it actually makes up part of the eye socket as well. It's called the maxilla. And there's a little joint between the two sides. So technically you have two. So I'll put MX, maxilla. To the max, maxilla. This bottom big jaw down here is the mandible. Manly mandible. The other bones, if you look in the nose, you can see there's the perpendicular plate of the ethmoid. That's that back of the nose bone. This little guy, let me erase that. Maybe I'll make it yellow here. This bottom bone right here. This little guy right in here, this little triangle, that's a bone as well. And it goes behind your maxilla, kind of over the top of it back. So it makes it part of the hard palate in the top of your mouth, the roof of your mouth. We'll see him in just a minute. But for now, that guy's called a vomer. Vomer. So I think of a V. I'm going to put an upside down V there. That's the vomer bone. Vomer. Okay, I think that's all you can see from this angle. Let's flip the skull over and look from the inferior view here. Here you can see some of these facial bones. We're going to focus on those. This is the upper lip here. So that's the maxilla, MX. Over here you can see the maxilla extending on either side. Now if we look inside the roof of the mouth, this part that's right behind the teeth, that's part of the maxilla too, but it makes it part of the palate. So we call it the palatine or palatine process. We call it a process because technically it's part of the maxilla. So it's just a part of, a feature of. So that's the palatine process. And then right behind it, this green thing, also over here on this one, it's shown in dark green over there. That guy is called the palatine bone. So that's your hard palate. If you take a moment, you can feel that with your tongue. That's your back of your hard palate, right before your throat becomes really soft. All right. You can feel that. It's a palatine bone. Right behind that, this yellow chunk, I'm going to put another upside down V because that's another chunk of vomer. It's another piece of the vomer. So you can see the vomer from inside the nose a little bit. You can see it here, kind of in the throat, and you'll be able to see it. We'll take another view of it in a moment. And here, zygomatic. That's about all you can see from this view. All right, here we can see, if we use a magic X-ray here, we can kind of see inside the skull here, and this kind of pink red guy, that's the ethmoid. That's that really weird back of the nose situation. Here we can see the vomer and the palatine. Let me zoom up on it a little bit. There we go. So that yellow spike sticking down, that's that vomer. So you can imagine upside down V there. And then the green is the palate. So you can see that it actually extends up and makes up the side walls of your nose. And then it comes down and it reaches across and it makes up the roof of your mouth as well. That's the palatine process. Or no, it's the palatine bones behind the maxilla. So the palatine's kind of buried in the face. And so is the vomer. Here, if we look from the side, we can see the vomer and its relationship to the palatine. So here's the palatine process right here. This guy is the vomer. It doesn't look like a V from this shape, from this side. Vomer actually means plow. So if you've ever seen a plow blade, it's kind of shaped like that. It gets pushed from behind and it plows up the earth on either side. So this is the vomer, and it makes up part of the septum. So again, from the side, it's flat. This is the perpendicular plate of the ethmoid, the green, sticking down and attaches to it. So that's the vomer. It's above your hard palate, and you can just see little glimpses of it here and there. V for vomer. I don't know if it helps, but like I said, I come from kind of a comparative anatomy background. And a frog, there are a couple of weird teeth that extend down, one on each side, into the roof of the mouth. So frogs actually have a couple of weird peg-like teeth on the roof of their mouth. We don't have that, but they're called vomeron teeth. That's what it reminds me of, but that might not help you at all. Come on, pen. There we go. Okay. Do I have a picture that will show? Well, we'll look at this one. Okay. So one kind of fun question that I could ask are, what are the 7 bones that make up the inside of the eye socket? There's 7 of them. So let's examine them a little more closely here. Let's name them. So in the back, and I know it's labeled, but you know, go with me on this. In the back, we have part of the bat wing. The purple's a bat wing. So what is that bone that's like bat wings? What's the bone that's like bat wings? Sphenoid, you got it. So the sphenoid makes up the whole back of the eye. And it has this big crack in it. There's that optic fissure again. That's where the nerves and the blood vessels from the eye pass through. Sphenoid. Got a couple of other little bones in the middle. Making up the side walls, we have the forehead bone, comes down, makes the top of the orbit. What's the forehead bone? Frontal. Okay. From the side, we've got the cheekbone. Cheekbone is the cheekbone. Okay, like if you smile, the place where you might put blush, that's the zygomatic bone, right? The bottom of the cheek, you're correct, is the maxilla. So that's this here, MX. And you can see it makes up the floor of the eye, MX, right there. This inner wall, so we've got 4 bones that kind of make the walls. Frontal on top, zygomatic is lateral, maxilla is the bottom. And then over here on the side, we've got this little red guy. And this is a new one. Here's the term up here, lacrimal. That's the lacrimal bone. That's the one that your tear ducts run through. And so tears come out of this bone, which is kind of interesting. It's got a little lacrimal duct there as well. So that's the lacrimal, and that makes up the 4th wall, L. Internally, the back of the eye, we've got the sphenoid. Here's the weird little bone that goes in and makes the back of your nose. What's the back of your nose? Back of your nose. Ethmoid. I know, it's a weird one. So the ethmoid comes down. Here you can see this little green guy over here, little green booger sticking out. It's not a booger. That is part of the ethmoid. It's one of the nasal conchi of the ethmoid. And so that extends all the way up through the back of the nose, and you get a little chunk in the eye socket as well. Ethmoid. Okay, so that's the 7 bones. Frontal, zygomatic, maxilla, lacrimal, and then, oh, there's one more. There's a sphenoid in the back, the ethmoid there, and then this little guy. We have a tiny little chunk of the palate that sticks up and extends there too, because it kind of runs down and across. Palatine bone right there. P, palatine. Takes a little practice. Okay, it takes some practice. And if these words just sound like I'm saying blah, 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 that's okay. It won't forever. You just have to practice and practice it. I think we covered most of the features. Do you guys have any questions about any of these parts? I know. I'll put my chat window over the answers here. Let's review these one more time, guys. We did the cranium pretty well. I'm pretty happy with that. Let's do this one more time, just since we're here. Since we're together. Oh, question. Ethmoid's behind the nose. Yeah, it's the one on the front here is the nasal. And then if you look into the nose, that's where you can see the ethmoid, pieces of the ethmoid back there. It's a big, weird bone with flaps. You got it. Okay, let's see. All right, so let's start. What's this bone right here on the top of the nose? That should be easy. Top of the nose. Nasal bones. What's your top lip? Extends up to the eye socket too. Top lip. MX, maxilla to the max. Okay. What are your smiley cheekbones over here? Your blush bones. Zygomatic. That's the bone, and you can't really see it from here, but the process sticks off of it and makes the rest of the cheekbone. That, by the way, that's a unique mammal thing. You don't find that zygomatic bone and the zygomatic arch like that in reptiles. What it allows us to do as mammals is chew. We have more chewing muscles on our skulls than reptiles or amphibians, so we can really chew things effectively. That's just a sidebar. Like I said, I come from like a comparative anatomy perspective. So what's a big old jaw called? Manly mandible. Got it. What's the bone in the corner of the eye here? Corner of the eye. Lacrimal, yeah. Okay, good. Let's see, I need another view. Here we go. That's a good one. Looking from the bottom, inferior view of the skull. What is this? What is this bone and what is that part of the bone? So what is this bone first? The roof of the mouth, right behind the teeth. MX, maxilla, good. And what is this is a process of that. What do we call that process? Good. Palatine process. PP, palatine process. What's the green bone just behind it? Roof of the mouth. Palatine bone. Good. Looking over here, you can see the maxilla still sticking out on the sides. Here's that cheekbone one more time, your smiley cheekbone. What's your smiley cheekbone? Zygomatic. Ooh, here's one we haven't talked about. What is this little chunk right in the middle? It makes up the bottom divider of your nose, and you can also see it here. If you imagine the letter V. Vomer. You got it. Kind of cozies up to the bat here, to the sphenoid. Good. Oops. Good. Any questions? Any other questions about skulls so far? The vomer divides, let's go take another look at it. The vomer is part of the divider of your nose, and it also kind of hooks up the, so you can see the two sinuses here, right and left. It divides up those nasal sinuses. And in fact, let's take a look at that because I don't think we talked about that. There you can see the vomer. See, it's this divider. From the side, it looks like a plow. It looks like a blade that sticks down. So the vomer divides the left and the right nose. Here we go. So this is looking at your sinuses. And so that vomer, the bottom part of your nose is going to help divide the two nasal sinuses. which there's one here and there's one here. So these are spaces inside your skull. It might also surprise you, though, that you have some in your forehead called frontal sinuses. And then the ethmoid and sphenoid have some gaps in them as well. We can see them if we look from the side. Look at all the red ones. Those are ethmoid sinuses, a whole bunch of little caves. And then behind that's the sphenoid sinus. When you get a cold, all of those can fill up with mucus, which feels terrible. And if you're unlucky, if those get plugged up with mucus, you can get a secondary infection started in there. Anaerobic bacteria can start growing, and that makes you feel terrible all over again. That can happen after you have allergies too. Just get a lot of mucus in there. Okay. It's all plugged up, etc. Okay, any questions about the skull before we move on? We should probably talk about the rest of the skeleton. Woo, here's a big question. Okay. In most of the diagrams, they point to the corner of the eye for ethmoid. Okay, but lacrimal, let's see. Did I point to the wrong thing? That could be too. Let's take another look. Okay, here you can see it. Let me zoom up. So right there, the green bone that's in front, the bright green one, that's the lacrimal. And then right behind it, there's a little chunk of ethmoid right behind it. So we can see that in, I like this one better. So you can see that here too. See right in the very corner of the eye, making up the side wall there, that's the lacrimal. And then that green bone right behind it, here the colors are reversed, but the green bone right behind it's the ethmoid. So the very corner of the eye, the part you can touch, that's lacrimal. Right behind it is going to be ethmoid. You don't want to touch that with your finger. Does that make sense? Okay, good. Any other questions about the skull? Practice, practice, practice. Take one view at a time, practice it. Take a break, come back, do another one. All right. Other bones that make up the axillary skeleton. These are the inner ear bones, and I'll just mention them here. We've got the malleus, incus, and stapes. These are buried in the skull. They're not really attached to the other bones. They help conduct sound. We're going to talk about them later. We're going to talk about the ear in all kinds of detail. This little guy is interesting. This is called the hyoid bone. I believe this is a mammal thing too, if I remember right. Anyway, it wraps around the voice box. So it's around your larynx, way up just right under your chin. So you can't really feel it. It's buried under some muscle in there. But some of your tongue muscles attached to that hyoid. So it helps you with speech. It helps support that larynx as well. Helps with swallowing too. If you look at it, it's really tiny, but it always reminds me of a little baby vampire jaw. Like if you found it, you might think you found a baby vampire, okay, or maybe a baby bat or something. But it's got these little processes that are little teeth. This doesn't attach to any other bones either. It kind of just hangs out around the larynx and is tied in with ligaments, connective tissue. So you just need to recognize it and know what it does. All right, vertebral column. Look at all the bones that make up the vertebral column. They all have names. But the good thing is that they're named according to a numbering system. So that makes it easy. I'm not going to put a single vertebra out and ask you for its specific name. That'd be a little too much detail. But you do need to know the major categories. And you need to know how many of each one you have. All right, so let's take a look at that. So here's your vertebral column. You have 7 cervicals. Cervical's neck, remember your body regions. You have 12 thoracic, make up your thorax. Your ribs are going to attach to these guys. 5 lumbars. And then you have 5 vertebrae that are fused together. As an adult, they're totally fused. There's no cartilage in there at all. It's called the sacrum, big triangular bone. Nothing else looks like the sacrum, easy to recognize. And then your little tailbone is called the coccyx. It's got 4 little vertebrae, or 5, depending on the scientist you're talking to. Little fused vertebrae. Okay, how do you remember that? Well, if you have breakfast at about 7, then you'll probably be ready for lunch around 12, and you might be ready for dinner around 5. Breakfast, lunch, dinner, 7, 12, 5. Okay. Let's look at these different vertebrae. If I put one out on the table, on a virtual table, I want you guys to recognize them. So here on the left, we have cervicals. Cervical vertebrae tend to be fairly small, and they don't have very prominent processes. So you notice over here that on the right, the thoracic, the upper back one, it's got these big processes, the transverse and the spinous processes that stick out. So the cervical tend to be smaller, and they don't really have that too much. Okay, they tend to be kind of rounder. Thoracic have these prominent processes. If we look at it from the side, it especially has a really long spinous process. Okay, so you can think of those sticking out of your spine posteriorly. All of them have an area called the body. These are what are going to actually connect together within the vertebrae. So this is how the vertebrae sit on top of one another. And then they all have a canal in the middle. It's called the vertebral foramen. Is it labeled? It's not labeled. Kind of important part. Vertebral foramen, that's where your spinal cord goes. Okay, so cervical, smaller, round, don't have big processes. Thoracic, they have a really long spinous that sticks out. Spinous process. Comparing thoracic to lumbar, lumbar is super easy to tell apart, right? Look at that thing. It's huge. It's got a gigantic body. That's because these lower back ones support a ton of weight. All the weight of the upper body gets put on these guys. So they have big fat bodies, big discs of cartilage between them. And then the transverse processes sometimes have these little antlers. They have extra little spikes on them. So it looks kind of like a moose. It's probably a lumbar. And look, the spinous process has a little extra branch on it here as well, compared to the thoracic that's pretty straight, like a blade that sticks out. Okay. So for any of these vertebrae, you should be able to recognize the basic parts of all of them. And you should be able to tell me which category they go in. Okay. They are named according to a numbering system, which is nice. So these guys up at the top, the cervical, there's 7 of them, C1 through C7. The thoracic, T1 through T12. Here it's shown there. C1, T1 through T12. The lumbar, L1 through L5. And then let's see if I have a diagram of the sacrum. I'll come back to that. Sacrum, big triangular chunk of bone. This makes up the back of your pelvis. It's got big holes in it. That's for nerves and blood vessels to pass through, which we'll see, and your tailbone is on the bottom. You don't have to know the names of those vertebrae. You just need to know sacrum, coccyx, and a few parts which are specified on your lab handout. Okay. I wanted to show you guys these 2 cervical vertebrae. They're a little bit special. This is the C1 and C2. The C1 is called the atlas. Who was Atlas in Greek mythology? Do you guys remember? Who was Atlas?
He holds the world.
He holds the whole world. Yeah, he's the god that holds the world. There he is, doing his job. So Atlas holds up the world. This first vertebrae holds up your skull. So it's called the atlas. These little processes here articulate with the occipital condyles on the occipital bone. So that's where your skull sits, right there. Notice this big atlas is just like a big fat ring. Okay. This allows you to tilt your head forwards and back. So we say the atlas is the bone that lets you say yes. Just below it, we have this guy, the axis. It lets you turn your head on its axis. So this is the bone that lets you say no. And it does so because it has this special process that sticks up that would actually go through the atlas. It sticks into that atlas. It's called the dens or the odontoid process, and it's what allows you to turn your head laterally side to side. Oh, 1 minute. Okay, I want to show you something real quick. We can continue. The rib cage is really not that hard. There's just a couple parts to know on the rib cage. So we almost got through everything, which is cool. I want to show you guys something really quickly, and then I want to tell you what to do next. I'm getting in my own way. Now, of course, my fingers won't work. Here we go. So I have this necklace. I got this from a local artist. She likes to use all kinds of like naturey stuff to make jewelry. So I have some from her where she has like parts of insect parts and all kinds of crazy stuff. But this one, I don't know if you can see it. There you go. It has a tiny little atlas and a tiny little thoracic vertebrae on it. It's a necklace. And when I picked it up, I was like, oh, an atlas. And she's like, you're the first person to recognize that. And we all we nerded out for a minute. But these apparently are from a muskrat. I wouldn't have known that. It's pretty specific. But these are a couple of vertebrae from a muskrat mounted into a piece of jewelry. So that's my nerdy jewelry for today. All right, let me show you. Oh, I'm still sharing my screen. That would have been easier to see closer up, but anyway. For next time, don't wait for us to start to go over this together before you start learning it. Start today. Work on that axial. And then the other part is the whole appendicular. We haven't even gotten to the arms and legs, y'all. So the appendicular lab is here. It's also going to have you go through the PAL, Practice Anatomy Lab, and it's going to have you go through the videos there. There is one video that's messed up. So on this page right there, I posted another link that will help you with that fibula bone in the lower leg. Okay, review, 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 start doing it. And then next time when we go over that stuff, it'll just be a little bit of review for you. And we will we'll work on making a guide together next time as well. Okay, chapter 7, finishing it up next time. Groove Rabba. Groove Rabba.